Hello, and welcome back to Griph&Gray podcast. I'm Griffless, and today I'm here to tell you about a story that is not so interesting. I mean, it's very bizarre. Okay, a German nurse has been sentenced to life for killing 10 of his patients and also attempting to kill 27 other patients. So, for some reasons, this nurse who is 44 years, for some reasons, his identity has not been disclosed to the public. But all we know is that this nurse works in Germany in a palliative care. When we talk about palliative care, we are talking about care for people who are ill and we don't have a cure for their illness. So we want to support them, alleviate their anxiety, their pain, and help them go through their life. So this is where this person works. So he's working with people who have end-stage diseases, cancers that there is no cure for. That's where this man works. And in the year 2023 to 2024, this man had been committing murder when he goes to night shift and he thinks that the workload is too much. Then he will look into the patient or where was you free no sharp. Then will give you lethal doses of painkillers and sedatives so that you are already gone. Okay, so the motive ni nyinaa say adwuma ne dɔɔso, and the prosecutor of this man said that the man suffers from a severe personality disorder, and also he's a narcissist and works in this nursing profession where he doesn't even want to work in this profession. On penal wakwaku pie he shows no compassion for patients, especially when patients are making complaints. It irritates him. Sharp and say me you free war panier, then he kills you. And he was using morphine and midazolam. Okay, so let's go to school some more. You know, in Ghana, tramadol are making waves in the internet, and I have to school you some more. You know, I'm your physician assistant, so when it comes to drugs and things, I have to tell you more about that. You get the vibes, yeah. So morphine is an opioid, okay? It's a painkiller, but it belongs to the opioid category. And one thing about opioids is that when you give higher doses of opioids, okay, it can depress the person's respiratory system, then also depress the cardiac system, the cardiovascular system, okay. Nti ni chire mu nyina nse ti mema utua home na asanso stop yakoma. So this is what the man was doing. Nti oba no na ohwe na adwuma ndoso anene painkiller no. You see, in palliative care, most of the patients are going through pains. Until you have to give them painkillers, manage their pain as much as possible. You don't want your cancer patient to be feeling pain, so you give them opioids so that they can they can get off their pains. You get the something. So it means he has these opioids at his disposal, but the maximum dose that you can give. And this man, when he goes not now here and then you more things also amount 10 milligram and then withdraw 100 milligram, not the hour feel. Then the next day so he has been doing that since 2023 to 2024, and also using midazolam. Midazolam is a sedative and a muscle relaxant. We use it in anesthesia, also to manage status epilepticus and all that. Okay. And also know the same as morphine can depress the respiratory system and also depress the cardiovascular system, stopping people from breathing and also stopping the heart from working. That's what he has been doing. But here's where it gets interesting. Okay, when they asked him as part of the trial, when they asked him why he did that, this is what he said. So he said, I wanted to do something good for the patients. The patient should sleep because sleep is the best medicine after all. So he comes and you are going through pain. He can't stand the patient going through pain, and he wants them to sleep. Shut them quiet, cry, no a war panier. Because if you sleep, to him, sleep is the best medicine after all. And you know, this is what is going on in Germany. This is what has happened in Germany. And Omotana Nasemneson has been sentenced to life imprisonment. And they say that there may not be possibility for him getting early release. You know, in Germany, when we say you are sentenced to life, the minimum is 15 years. But for him, yɛntimi mma no kwan sɛ ɔmɛyɛ saa. Okay, enti no na nea ɛwɔ hɔ no no, today I came to you with this news. Ɛnyɛ nea ebedi ɛne borɔfo no adɔɔso. Okay, and in case you haven't subscribed to this channel, make sure to subscribe to this channel. Follow us for more content like this one. All right, see you again in the next video.